Ever considered what cancer really is? It's a disease where cells grow out of control, spreading across the body, thereby affecting normal cell-cell division. Abnormal cells can multiply incorrectly, forming tumors, malignant if cancerous, benign if so. How do cancer cells differ from normal cells? Cancer cells grow even when there are no signals telling them to do so, whereas normal cells only grow when they receive such signals. They resist signals that normally tell cells to stop dividing or to undergo programmed cell death, a process called apoptosis. They invade nearby areas and spread to other parts of the body, unlike most normal cells. Cancer cells manipulate blood vessels to grow towards them, supplying them with oxygen and nutrients. They hide from the immune system and sometimes trick immune cells into supporting tumor growth. They accumulate changes in their chromosomes, affecting their behavior, and rely on different nutrients and energy pathways than normal cells, allowing for faster growth. Now, there are various classes of anti-cancer drugs, each targeting different aspects of cancer cells. One common type is alkylating agents. These are chemotherapy medications that work by damaging the DNA of cancer cells, preventing them from dividing and growing. Alkylating agents attach alkyl groups, which are carbon-hydrogen chains, to DNA molecules. This attachment disrupts the DNA structure and interferes with the cell's ability to copy its DNA during cell division. Without proper DNA replication, cancer cells can't reproduce and eventually die. Alkylating agents are effective against a wide range of cancers, including leukemia, lymphoma, Hodgkin's disease, multiple myeloma, melanoma, brain tumors, lung cancer, breast cancer, ovarian cancer, and testicular cancer. These medications are often used in combination with other chemotherapy drugs or radiation therapy to increase their effectiveness. There are several different types of alkylating agents, each with its own mechanism of action and side effects. Some common examples include nitrogen mustards, alkyl sulfonates, nitrosoureas, and triazines. So, to wrap things up, cancer is a disease of uncontrolled cell growth, invasion, and spread. It differs from normal cells in growth control, response to signals, invasion, blood vessel manipulation, immune system evasion, chromosome abnormalities, and nutrient usage. And the fight against cancer involves a variety of anti-cancer drugs, including alkylating agents that target these cancer cell characteristics. Understanding cancer and its treatment is a big step towards a healthier world. Remember, knowledge is power.
Ever wondered how chemotherapy drugs work to fight cancer? It's a complex process, but let's break it down in a simple, understandable manner. First, we have alkylating agents. These work by directly damaging the DNA of cells, which prevents them from multiplying. These agents can treat a wide range of cancers. However, like all medications, they come with side effects. These can include nausea, fatigue, hair loss, and an increased risk of infection, among others. The severity of these side effects can vary depending on the specific medication, dosage, and individual patient. Next, we have anti-metabolites. These clever drugs mimic the molecules that cancer cells need to build their DNA and RNA, the building blocks of life. Because of their close resemblance, cancer cells mistakenly incorporate the anti-metabolites into their DNA and RNA instead of the natural building blocks. Once incorporated, the anti-metabolites disrupt the normal function of DNA and RNA. This prevents cancer cells from copying their DNA properly, which is essential for cell division and growth. Ultimately, this leads to the death of the cancer cells. Anti-metabolites are effective against a broad range of cancers, including leukemia, lymphoma, colorectal cancer, breast cancer, and many others. They are often used in combination with other chemotherapy drugs or radiation therapy to enhance treatment outcomes. Examples of anti-metabolites include 5-fluorouracil, methotrexate, mercaptopurine, theoguanine, and gemcitabine. However, like alkylating agents, anti-metabolites also come with side effects. These can include nausea, fatigue, mouth sores, hair loss, diarrhea, and an increased risk of infection. In summary, chemotherapy drugs like alkylating agents and anti-metabolites are valuable tools in the fight against cancer. They work by damaging the DNA of cancer cells or disrupting their growth, leading to the death of these cells. However, they also come with significant side effects, and doctors must carefully weigh the risks and benefits before prescribing these medications to patients. It's a complex process, but one that has been crucial in our ongoing battle against cancer. Remember, knowledge is power. The more we understand about how these treatments work, the better equipped we are to fight this disease. So stay informed, stay positive, and ever wondered what anti-tumor antibiotics are and why they are so important in the fight against cancer? Well, let's unravel this mystery. Anti-tumor antibiotics, also known as anti-cancer or anti-neoplastic antibiotics, are a distinct class of chemotherapy drugs, crafted with the sole purpose of battling cancer. Unlike traditional antibiotics that target bacteria, these specialized drugs are derived from natural substances produced by a type of soil fungus, specifically Streptomyces. Their mission isn't to fight bacteria, but to zero in on rapidly dividing cancer cells. They disrupt the genetic material within cancer cells, either by interfering with DNA replication or causing direct damage to the DNA, effectively hindering the growth and division of these cells. Think of them as microscopic superheroes, swooping in to save the day by halting the advance of villainous cancer cells. Now that we understand what anti-tumor antibiotics are, let's delve a bit deeper into their origins. Anti-tumor antibiotics originate from a rather surprising source: soil fungus. Yes, you heard it right. These powerful cancer-fighting agents are derived from natural substances produced by a specific type of soil fungus called Streptomyces. This humble origin in the Earth's soil gives rise to a class of drugs with potent abilities to combat one of humanity's most dreaded diseases, cancer. But how do these antibiotics function? Unlike their traditional counterparts that target bacteria, anti-tumor antibiotics have a different quarry: rapidly dividing cancer cells. These drugs are designed to disrupt the very lifeblood of cancer cells, their DNA. Imagine the DNA as a blueprint, an instruction manual for the cell. In a normal cell, this manual guides the cell's functions, ensuring everything runs smoothly. But in a cancer cell, the manual has gone haywire, leading to uncontrolled growth and division. This is where anti-tumor antibiotics come in. They interfere with the rogue instructions in two primary ways. Firstly, some of these drugs prevent cancer cells from copying their DNA accurately. This hinders the cell's ability to divide and grow, effectively stifling their rapid proliferation. Secondly, certain anti-tumor antibiotics cause direct damage to the DNA of cancer cells. This is akin to tearing pages out of the rogue manual, leading to the eventual breakdown and death of the cancer cell. So, these antibiotics are not just targeting the cancer cell, but they're going right to the heart of the problem, the DNA, and disrupting its functioning. It's a bit like going into a factory and ripping up the production manual. Without it, the factory can't function properly and eventually shuts down. This dual approach of interfering with DNA replication and causing direct DNA damage makes anti-tumor antibiotics a potent weapon in the fight against various types of cancer. They offer a distinct strategy, attacking cancer at its core, the rapid growth and division of cells. So, these antibiotics go right to the heart of the cancer cell, its DNA, and disrupt its functioning. With this mechanism of action, anti-tumor antibiotics hold a unique and promising position in the vast landscape of cancer therapeutics. Anti-tumor antibiotics are potent weapons in our arsenal against cancer. These chemotherapy drugs demonstrate their effectiveness by targeting a multitude of cancer types. For instance, both acute and chronic forms of leukemia are susceptible to the power of these antibiotics. Lymphomas, including both Hodgkin's and non-Hodgkin's variants, also fall within their purview. Furthermore, solid tumors like those found in breast cancer, lung cancer, ovarian cancer, and sarcomas are not immune to the disruptive abilities of these drugs. The versatility of anti-tumor antibiotics allows for their usage in combination with other chemotherapy drugs or radiation therapy. This results in a more robust and comprehensive treatment strategy, increasing the chances of success in the battle against cancer. In essence, anti-tumor antibiotics are not just standalone soldiers. They are part of a larger battalion, working in harmony with other treatments to launch a full-scale assault on cancerous cells. These antibiotics have proven their mettle against multiple types of cancers, often working in tandem with other treatments. There isn't just one type of anti-tumor antibiotic. Let's get acquainted with some of the most common ones. Anti-tumor antibiotics come in several types, each with its unique mechanism of action. Let's dive into a few of them. Firstly, we have the anthracyclines, a group that includes well-known drugs like doxorubicin and daunorubicin. These mighty warriors interfere with DNA replication and damage the DNA itself. Imagine a factory assembly line producing a faulty product over and over again. That's what anthracyclines do to cancer cells. They interfere with the production line, or in this case, the replication of DNA, causing the cells to produce flawed copies that can't survive. Next up, we have bleomycin. This anti-tumor antibiotic is like a demolition expert, causing breaks in the DNA strands. Think of it as a pair of scissors, snipping away at the DNA strands and causing damage that the cancer cells just can't repair. Then there's dactinomycin, also known as actinomycin D. This medication interferes with RNA synthesis, a crucial step in protein production needed for cell growth. It's like a saboteur sneaking into the factory and messing with the machinery. By disrupting RNA synthesis, dactinomycin hinders the cancer cell's ability to produce the proteins they need to grow and divide. Finally, let's talk about mitomycin. This anti-tumor antibiotic is a double threat. Not only can it damage DNA, but it can also inhibit DNA replication. It's like a 1-2 punch, first causing damage to the DNA, and then preventing the cancer cells from making accurate copies of their DNA. Each of these antibiotics has its unique way of disrupting cancer cell DNA. Some interfere with the replication process, others cause direct damage to the DNA, and some do a bit of both. Yet they all share a common goal: to stop the rapid growth and division of cancer cells. Each of these antibiotics has its unique way of disrupting cancer cell DNA, making them a valuable tool in cancer treatment. Opening. As with any potent treatment, anti-tumor antibiotics do have side effects. Indeed, these powerful drugs are not without their drawbacks. While they are adept at targeting and disrupting the DNA of cancer cells, this process can also lead to a range of side effects. Let's delve into a few of them. One common side effect that many patients experience is nausea and vomiting. This is because the drugs can disrupt the normal functioning of the digestive system. Similarly, fatigue is another frequently reported side effect, as the body uses a lot of energy in the fight against cancer, leaving patients feeling worn out and tired. Another side effect that many people associate with chemotherapy, including anti-tumor antibiotics, is hair loss. This occurs as the drugs target all rapidly dividing cells, not just the cancerous ones. Hair follicle cells, which grow quickly, are often affected, leading to hair loss. Anti-tumor antibiotics can also increase the risk of infection. They can disrupt the production of white blood cells, which are crucial for fighting off infections. This means that patients taking these drugs may be more susceptible to catching infections and may take longer to recover from them. More severe side effects include bone marrow suppression, which can lead to anemia and potential damage to the heart and lungs. Bone marrow suppression can decrease the production of red blood cells, leading to anemia and associated symptoms like fatigue and shortness of breath. Heart damage is a particular concern with the anthracycline group of anti-tumor antibiotics. They can cause changes in the heart muscle, leading to conditions like cardiomyopathy or heart failure in severe cases. Bleomycin, another anti-tumor antibiotic, can potentially cause lung damage, leading to difficulties with breathing. The severity of these side effects largely depends on the specific drug used, the dosage, and the individual patient's tolerance. It's crucial to remember that while these side effects can be challenging, they are often manageable with the right care and support. Closing. While these side effects are significant, they are a trade-off for the effectiveness of these antibiotics in treating cancer. We've covered a lot of ground today on anti-tumor antibiotics. Let's take a brief moment to recap. Anti-tumor antibiotics, unlike their traditional counterparts, are derived from natural substances, specifically a type of soil fungus known as Streptomyces. Their main target? Rapidly dividing cancer cells. The primary function of these unique drugs is to disrupt the DNA within these cancer cells, and they accomplish this through several mechanisms. Some interfere with the process of DNA replication, preventing cancer cells from accurately copying their DNA, which hinders their ability to divide and grow. Others directly damage the DNA of cancer cells, leading to their ultimate demise. Next, we delved into the effectiveness of these drugs. Anti-tumor antibiotics have shown to be effective against various types of cancer, including both acute and chronic forms of leukemia, Hodgkin's and non-Hodgkin's lymphomas, as well as solid tumors like breast cancer, lung cancer, ovarian cancer, and sarcomas. These drugs are often used in combination with other chemotherapy treatments or radiation therapy to create a more comprehensive treatment strategy. We also explored the different types of anti-tumor antibiotics, from the well-known anthracyclines such as doxorubicin and daunorubicin that interfere with DNA replication and damage DNA,
to bleomycin, which disrupts DNA by causing breaks in the strands. We also touched on dactinomycin, which interferes with RNA synthesis, a crucial step in protein production needed for cell growth, and mitomycin, known to damage DNA and inhibit DNA replication. But like any medication, anti-tumor antibiotics come with potential side effects. These can range from nausea and vomiting, fatigue, hair loss, an increased risk of infection, to more severe effects like bone marrow suppression leading to anemia, heart damage, particularly with anthracyclines, and lung damage with bleomycin. In summary, anti-tumor antibiotics are a valuable tool in our arsenal against cancer. Their unique approach of targeting the rapid growth of cancer cells through DNA disruption sets them apart. However, their potential side effects necessitate careful monitoring by doctors. Anti-tumor antibiotics, with their unique DNA-disrupting mechanism.
Ever wondered how hormones can affect cancer? A fascinating question, isn't it? Hormones, those tiny chemical messengers in our bodies, have a complex and intricate relationship with cancer. It's not as simple as hormones equal cancer, but they do play a significant role in some types. Take hormone-dependent cancers, for instance. These are cancers that rely on specific hormones for growth and division. Imagine a plant that only thrives with a particular type of sunlight. That's how these cancers behave with certain hormones. For example, some breast cancers have a fondness for estrogen and progesterone, using these hormones to fuel their growth. Similarly, certain prostate cancers often have receptors for testosterone, which acts like a growth signal for them. So, hormones and cancer, it's a complicated relationship, one that we're still striving to fully understand. But understanding it, we are. Now let's delve deeper into the role of hormones in specific cancers. First, let's look at hormone-dependent cancers. These are cancers that, quite literally, feed on hormones. They have receptors that latch onto certain hormones, using them as a kind of fuel to stimulate their growth and division. Let's take breast cancer as an example. Some breast cancers have receptors for estrogen and progesterone. Imagine these receptors as little locks and the hormones as the keys. When the key turns the lock, it sets off a chain of events that can promote the growth of these tumors. Similarly, we have prostate cancer. Much like the breast cancer example, prostate cancer cells often have receptors for testosterone. When testosterone, the key, finds its way to these receptors, the locks, it can fuel the growth of the cancer. But not all breast or prostate cancers are hormone dependent. Only those with the specific hormone receptors can use these hormones as growth signals. That's why it's essential to identify the type of cancer and its specific characteristics before deciding on a treatment strategy. Now you might be wondering, why does this matter? Well, understanding the role of hormones in these cancers provides us with valuable insights into how they grow and spread. It also opens up avenues for targeted treatments, which we'll delve into in the next scene. It's important to remember, though, that hormones are not the villains here. They're crucial for numerous bodily functions, from regulating our metabolism to influencing our mood. But like many things in life, it's all about balance. When the balance is tipped and there's an overexposure to certain hormones, that's when problems can arise. So hormones can indeed fuel the growth of certain cancers. But what does this mean for treatment? How can we use this knowledge to our advantage? Well, hold on to your hats because we're about to dive into the fascinating world of hormone therapy in cancer treatment. Imagine if we could turn off the fuel supply for these cancers. That's exactly what hormone therapy aims to do in the treatment of hormone-dependent cancers. Hormone therapy is a powerful tool in the arsenal of cancer treatment strategies. It's like a targeted strike designed to hit cancers where it hurts them the most, their dependency on hormones. But how does it work? Let's start with hormone receptor antagonists. These are special medications that block the binding of hormones to their receptors on cancer cells. Think of it like a lock and key situation. The hormone is the key, and the receptor on the cancer cell is the lock. When the key fits into the lock, it signals the cancer cell to grow and divide. But what if we could jam that lock, preventing the key from fitting in? That's what hormone receptor antagonists do. They effectively starve the cancer cells of the growth signal they need to thrive. Then there's the strategy of decreasing hormone production. Sometimes we can use medications or even surgery to reduce the production of hormones that promote cancer growth. A classic example of this is in the treatment of hormone receptor-positive breast cancer. Sometimes removing the ovaries can drastically reduce estrogen production, thereby slowing the growth of the cancer. These two strategies, blocking hormone action and decreasing hormone production, can be remarkably effective at slowing the growth of hormone-dependent cancers. They can even stop the growth entirely in some cases. But it's not a one-size-fits-all solution. The effectiveness of hormone therapy varies from person to person and depends on the specific type of cancer. However, in many cases, it can significantly improve outcomes and offer hope to those affected by these types of cancers. So, by blocking hormones or reducing their production, we can potentially slow down or even stop the growth of hormone-dependent cancers. It's a testament to the power of understanding the unique biology of each cancer and tailoring our treatments accordingly. But can hormones also increase our risk of developing cancer? Now this is where the plot thickens. Hormones, while essential for our body's normal functioning, can also be a double-edged sword. Chronic exposure to certain hormones can indeed heighten the risk of developing some types of cancers. Let's take estrogen, for instance. This hormone is naturally produced in our bodies and plays a pivotal role in the reproductive process. But when estrogen levels remain high over an extended period, it can be a risk factor for certain breast cancers. This is because estrogen can stimulate the growth of breast tissue cells, and if these cells become cancerous, the high estrogen levels can potentially expedite their growth. It's a delicate balance, isn't it? Hormones are necessary, but they can also pose risks. So while not all cancers are hormone-dependent, hormones can certainly play a role in cancer risk. So it's clear that hormones play a complex role in cancer. We've explored how certain hormones can act as growth factors, promoting the development of hormone-dependent cancers like some breast and prostate cancers. We've also delved into how hormone therapy can be used as a treatment strategy, either by blocking hormone action with receptor antagonists or by decreasing hormone production. But it's essential to remember that not all cancers are hormone-dependent. Many cancers arise due to genetic mutations and other factors not directly linked to hormones. Chronic exposure to certain hormones can increase the risk of developing some cancers, but it doesn't guarantee it. Understanding the hormonal influence on specific cancers can pave the way for targeted treatment strategies like hormone therapy. But this is just one piece of the puzzle. Other factors like genetics and the immune system play equally important roles. Remember, while hormones can play a significant role in some cancers, they are not the whole story. A broader approach is